So this is not a non-disclosure policy. This is how we do business in terms of public health. When there is a risk to the public that we cannot identify individuals who might be exposed to somebody with a disease, and in this case we're talking about COVID-19, we put that out publicly. And there's been quite a bit of that recently, where people have been in certain premises, they've been in a public space where there might be other people at risk and we can't identify them individually. We put that out in the public domain. That's how we have always done this. I think the challenge right now is that these things have evolved over time. And initially, of course, we had very small numbers of people who were coming in from other countries. And it became incredibly important to make sure that they were not individually identifiable. Because with this disease, as with many communicable diseases, there is still very much a stigma associated with it. So this is a practice that we are all using across the country. It's consistent in how we're applying the approach. Quebec, for example, is talking about communities where they have transmission in that community and they've put in place measures. We're talking about outbreaks that are happening in public or in facilities. Those are things that are consistent with our approach from public health perspective. So it's not a non-disclosure policy in any way. It's about how we best able to support people. And I think the other thing in the transition that we are seeing is that we now have community spread, and we don't have the ability to know everybody in our environment who has this disease. So the measures that we have been directing people to take across the province around physical distancing, around not gathering, around not having people together in clusters in our homes, in our churches, in other public settings, about closing restaurants, this is because we all need to put space between us to stop the transmission of this virus from those unknown cases. And that is in every community, and it is even incredibly important in small communities where we don't yet have any tested cases, for example. So this is not something that is about protecting people's privacy necessarily, although that is obviously an important consideration. It's about risk to the public and understanding where that risk is and the measures that we all need to take right now in our communities across the province.
Nothing to add to anything Dr. Henry said, just the question I think you asked me. I think one of the things about British Columbia and the way we've managed this that is very valuable, and I'm not going to talk about any other provinces, people can see that in other jurisdictions, is that we've had a provincial approach from the beginning. Dr. Henry and Steve Brown are the head of a structure that involves all of the health authorities, all the regional health authorities, the provincial health authorities, and the First Nations health authorities. That's our view of things, whereas in other jurisdictions, I think it's fair to say that health is somewhat more decentralized among more units. So we have, I think, gone on this path from the beginning of managing this provincially, and I think there's been huge advantages in doing that from the beginning, and there'll continue to be advantages as we go forward.